Did you know that pancreatic cancer is still one of the deadliest cancers in adults over 60? Not because doctors cannot treat it, but because most people never recognize what it is doing until it is far too late. That is the part almost nobody says clearly enough. This disease usually does not begin with one dramatic collapse. It begins with quiet changes, changes that look ordinary, changes that sound harmless, changes seniors explain away every single day as stress, aging, indigestion, diabetes, dehydration, a bad back, or just one of those weeks where nothing feels quite right. And that is exactly how pancreatic cancer buys time. Right now, as you listen to this, there are seniors sitting in living rooms, eating at kitchen tables, waking up in the middle of the night, going to the bathroom, rubbing their backs, skipping meals, blaming exhaustion, and never once imagining that their pancreas may be sending a warning signal. Not because they are careless, because nobody connected the dots for them in time. I am Dr. Arthur Mark, and in the next few minutes, I am going to walk you through 8 symptoms of pancreatic cancer seniors should never ignore, especially symptom 5. That one has blindsided people who thought they were dealing with something completely unrelated. Everything else I show you today builds toward that moment. Before we get into the list, you need to understand why this cancer is so dangerous in older adults. Your pancreas sits deep inside your abdomen. You cannot feel it from the outside. A routine checkup usually cannot find a problem there. Standard blood work often looks normal until this disease is already advanced. And many of the earliest warning signs overlap with conditions seniors already have, which is why they get mislabeled over and over again. That is the trap. Pancreatic cancer hides inside familiar discomfort. It borrows the language of ordinary aging. It disguises itself as something you think can wait, and seniors are the perfect target for that disguise. If you are over 60, you already expect your body to behave a little differently. You expect digestion to be less predictable. You expect aches to linger longer. You expect energy to fluctuate. You expect doctors to mention common things first because common things usually are the answer. Pancreatic cancer uses that expectation against you. But while it is still localized, outcomes are very different from what they are once it spreads. That window exists, it just closes fast. So pay attention to every one of these 8 symptoms, because the people who catch this earlier are usually the people who stop dismissing repeated changes as normal. The first symptom is dark urine. Most seniors who notice dark urine make the same mistake. They drink more water. The urine lightens a little. They assume the problem is solved. Then the color changes again a day later, and they decide they must still be dehydrated. That pattern is where the danger lives. Here is what may be happening inside your body. Your liver makes bile, and that bile travels through a duct near the head of the pancreas before it reaches the intestines. Bile contains bilirubin, a yellow-brown pigment that helps give stool its normal brown color. When a tumor near the head of the pancreas presses on the bile duct, bile cannot drain the way it should. Bilirubin backs up into the bloodstream, and the kidneys begin clearing that buildup through the urine. The result is urine that becomes much darker than usual, sometimes dark yellow, sometimes amber, sometimes brownish like tea or cola. And the detail that matters most is this. If the urine keeps turning dark again even after you hydrate, water is not fixing the underlying problem. Water does not remove a blockage. This is why dark urine should never be brushed off when it keeps recurring, especially if it appears with itching, pale stools, yellowing of the eyes, or upper abdominal discomfort. A single dark day may mean almost nothing. A repeated pattern means you need a medical conversation quickly. Now you understand why dark urine can be more than dehydration. But the second symptom is the one seniors are told is almost everything except the truth. That symptom is upper abdominal pain that spreads to the back. This is where months get lost. A senior feels an ache below the breastbone or across the upper belly. Then it starts wrapping around into the middle back. Someone calls it arthritis. Someone else calls it a pulled muscle. Maybe acid reflux, maybe posture, maybe an old injury acting up again. Pain medicine gets tried, heating pads get used, pillows get adjusted, and meanwhile the real cause keeps advancing untouched. Pancreatic pain often has a signature. It is not always sharp. In fact, many people describe it as dull, steady, pressure-like, or gnawing. It can begin in the upper abdomen and radiate straight through to the back because the pancreas sits deep in the upper abdomen near major nerves and surrounding structures. When a tumor grows there, it can irritate those nerves and nearby tissues. Here are the details that should make you stop and pay closer attention. First, the pain may worsen after eating. Not necessarily the second food hits your stomach, but often within a short period after a meal. Second, lying flat can make it feel worse, while leaning forward or curling slightly may feel better. Third, it tends to return in the same pattern no matter how many simple home treatments you try. And fourth, it often does not stay where you expect ordinary back pain to stay. It circles, it bores, it radiates. If that pattern sounds familiar, do not walk into a medical appointment and simply say, "I have back pain." Say exactly where it begins, where it travels, when it worsens, and whether meals make it worse. Specific details change what your doctor thinks about. Vague pain gets vague attention. Precise pain gets investigated. Now let me show you the third symptom, because this one is happening in dining rooms all over the country and being called something harmless every single night. Feeling full very quickly, losing your appetite, and dropping weight without trying. You sit down to eat. A few bites in and you are done. You push the plate away. Maybe you say your appetite is just not what it used to be. Maybe your family even jokes that you are finally eating less. Maybe the weight loss looks like a good thing at first. That reaction is exactly why this symptom gets missed. Pancreatic cancer can interfere with digestion in more than one way. A tumor can press on nearby parts of the stomach or small intestine and make it harder for food to move normally. It can also reduce how effectively the pancreas releases digestive enzymes, which means your body starts processing food less efficiently. The result can be early fullness, bloating, nausea after meals, reduced appetite, and steady, unplanned weight loss. And here is what makes this especially dangerous in seniors. Older adults expect appetite changes. They expect to eat a little less. They expect certain foods to bother them more than they used to. So a major red flag gets disguised as a normal life change. But unintentional weight loss is never something to shrug off. If you have lost 10 pounds, 15 pounds, or more without trying, and especially if that weight loss comes with poor appetite, back or belly pain, or changes in your stool, that is not a cosmetic issue. That is a medical clue. The body does not usually give up weight for no reason. And before we go further, I want to tell you something important. There is one symptom later in this list that many people never associate with pancreatic cancer until after the diagnosis is already made. I have seen families stare at me in shock when I explain that what sent their loved one to the emergency room was not a separate problem at all. It was part of the same disease. I am going to show you exactly what that is. But first, symptom 4 is often visible on the outside of the body before people realize what it means on the inside. The fourth symptom is jaundice, often with itching. Jaundice means the skin or the whites of the eyes begin turning yellow. In darker skin tones, the yellowing may be easier to notice in the eyes than on the skin. This happens when bilirubin builds up in the bloodstream, usually because bile is being blocked. And jaundice rarely travels alone. The same buildup that can darken your urine can also make your stool lighter than normal and trigger intense itching. Not a mild, dry skin itch. The kind of itch that seems to come from under the skin itself. Lotion does not fix it. Changing soap does not fix it. Antihistamines may barely touch it. That is because bilirubin in the skin can irritate nerve endings directly. Now here is where seniors get misled. Jaundice can happen from other causes, and gallstones are common. Liver conditions exist. Medication effects exist. So people assume yellowing must be something less serious or temporary. Sometimes even healthcare visits start down the wrong road because only one part of the picture gets mentioned. That is why symptoms should never be reported in isolation. If you have yellow eyes, say whether you also have dark urine. If you have itching, say whether your stools are lighter. If you have belly pain, say whether you are losing weight. The combination tells the story. The individual symptom may not. And if you have jaundice with fever, shaking chills, confusion, or severe pain, that is urgent. Do not sit on that. Now we are at symptom 5, and this is the one I told you to stay for because many seniors never hear it connected to the pancreas at all. The fifth symptom is an unexplained blood clot. Think about that for a moment. A swollen calf, a painful, warm leg, sudden redness, a heavy pressure in the thigh that makes walking uncomfortable. Or, out of nowhere, shortness of breath, chest pain when breathing in, a racing heartbeat, and a terrifying trip to the emergency room. Most people would never hear those events and think pancreas. But pancreatic cancer is one of the cancers most strongly linked to abnormal clotting. Tumors can release substances that make the blood more likely to clot. Sometimes the first clue that something deeper is wrong is not stomach pain, not yellow skin, not weight loss. It is a clot in a large vein, often in the leg. That is called a deep vein thrombosis. And if part of that clot breaks loose and travels to the lungs, it becomes a pulmonary embolism, which can be life-threatening. Here is why this matters so much. When a blood clot happens without a clear reason, no recent surgery, no long travel, no obvious injury, no major immobility, it should raise the question of whether an underlying cancer could be contributing. Not because cancer is the most common cause. It is not. But because missing that connection can cost months. If you ever develop leg swelling, warmth, redness, or calf pain that seems unusual, get it evaluated. And if you suddenly become short of breath or develop sharp chest pain, that is emergency care immediately. Not tomorrow, not after a nap, immediately. You now know something many seniors are never told at the time a clot is found. Sometimes the clot is not the whole story. Sometimes it is the warning shot. And if that idea feels surprising, good. It should. The most dangerous information about pancreatic cancer is often the information nobody thinks to connect until after the diagnosis. That is why this list matters. It is not just about recognizing symptoms one by one. It is about recognizing a pattern before the pattern becomes a crisis. And the sixth symptom is one more seniors need to hear about because it shows up in primary care offices every day and often gets treated as a routine metabolic problem when it may be something much bigger. The sixth symptom is new-onset diabetes, or diabetes that suddenly becomes harder to control. Your pancreas does two major jobs. One is digestive. The other is hormonal. It makes insulin, which helps control blood sugar. When pancreatic cancer interferes with that function, blood sugar can rise in ways that seem to come out of nowhere. A senior who never had diabetes is suddenly told they have it. Or someone who has been stable for years notices numbers climbing for no obvious reason. Medications that used to work stop working as well. Blood sugar becomes strangely unpredictable. At the exact same time, weight may be dropping instead of rising, appetite may be fading, and energy may be collapsing. That combination matters. Most diabetes in older adults is ordinary type 2 diabetes, and pancreatic cancer is not the most common reason someone develops high blood sugar. But when diabetes appears suddenly alongside unexplained weight loss, back or upper abdominal pain, jaundice, or stool changes, it deserves a deeper look. This is one of the most frequently missed patterns because diabetes is so common. A common diagnosis can hide an uncommon cause. And once that label gets attached, everyone starts focusing on sugar while the disease behind the sugar keeps moving. If you or someone you love was recently diagnosed with diabetes, and the rest of the picture does not make sense, do not ignore that discomfort. Ask why it changed. Ask whether anything else should be ruled out. Ask whether abdominal imaging is appropriate if other warning signs are present. Now, the seventh symptom is one families often describe with casual phrases that sound far too small for what they may represent. Nausea, vomiting, indigestion, or feeling sick after meals. Listen carefully to how people talk about this. My stomach has been off lately. Rich food does not sit right anymore. I keep feeling queasy after dinner. I thought it was reflux. I thought it was gallbladder trouble. I thought it was just getting older. Pancreatic tumors can interfere with digestion by affecting the release of enzymes and by pressing on nearby structures, including the lower part of the stomach or the first part of the small intestine. When that happens, food may not move through the digestive tract the way it should. The result can be persistent nausea, vomiting, bloating, discomfort after eating, and a heavy sick feeling that keeps returning. This is especially suspicious when the pattern repeats. Not one bad meal, not one night of heartburn, a repeated pattern. You eat, and within a short time you feel worse. You start avoiding meals because you know how you will feel afterward. The foods you used to tolerate suddenly become a problem. Fatty meals become especially miserable. And because many seniors already deal with reflux, ulcers, medication side effects, constipation, or gallbladder issues, this symptom gets absorbed into the noise of everyday medicine. That is why persistence matters more than drama. A recurring digestive pattern is often more important than one severe episode. If nausea or vomiting keeps happening, especially with weight loss, back pain, dark urine, or pale stools, it should not be treated as a separate inconvenience. It may be part of a single, larger process. And now we come to the 8th symptom, the one that shows up in the bathroom and tells you more about pancreatic function than most people realize. The 8th symptom is pale, greasy, floating stool. This is the symptom many people feel too embarrassed to mention. They do not want to describe it. They do not want to sound graphic. They do not think stool changes matter that much. They matter a lot. Your pancreas produces enzymes that help break down fat. If pancreatic enzymes are not reaching the intestine properly, fat is not digested the way it should be. That can create a very recognizable stool pattern. The stool may become pale, clay-colored, or gray instead of brown. It may look oily. It may float. It may smell much worse than usual. It may be difficult to flush. Some people notice the toilet water looks greasy. Others notice they are suddenly having larger, looser, more offensive bowel movements after eating. This is not random. It can be a sign that bile flow is blocked, that pancreatic enzymes are not getting where they need to go, or both. And this symptom does not just sit there by itself. It helps explain why weight loss speeds up, why certain foods trigger nausea, why energy drops, and why the body seems to be wasting away despite meals that should be enough. If fat is not being digested properly, calories are being lost, vitamins are being lost, and strength is being lost. If your stool has changed in this way for more than a brief period, especially alongside any of the other symptoms in this video, bring it up directly. There is no prize for being discreet about a cancer warning sign. Now, before you leave this video, I need your attention for one more minute, because what you do next matters more than anything I have said so far. If you recognized even 2 of these symptoms in yourself or someone you love, do not talk yourself out of it. Do not wait for the symptom to become unbearable. Do not decide to see whether it settles down next month. Pancreatic cancer is so deadly, largely because people wait through the exact phase when the body is still trying to warn them. Here is what to do instead. Write down the symptoms, not in your head, on paper. Dark urine, upper belly pain going to the back, eating less, weight loss, yellow eyes, itching, a recent blood clot, new diabetes, nausea after meals, pale, greasy stool. Whatever applies, write the exact symptom, when it started, how often it happens, and whether it is getting worse. Then call your doctor and read the list exactly as it is written. Do not water it down. Do not summarize it as feeling off. Specific symptoms lead to specific thinking. If your doctor only hears fatigue or stomach trouble, you may get brushed aside with a temporary explanation. If your doctor hears recurring dark urine, upper abdominal pain to the back, early fullness, weight loss, and stool changes, that is a different conversation. Ask whether imaging of the abdomen is appropriate. Ask whether the full combination of symptoms could point to a pancreatic or bile duct problem. If you have new diabetes plus unexplained weight loss and back pain, say all of it together. If you had a recent blood clot and now have digestive changes, say all of it together. You are not being dramatic. You are giving the medical system the information it needs to recognize a pattern before more time is lost. And if a symptom is severe, act accordingly. Jaundice with fever or confusion needs urgent care. Sudden shortness of breath or chest pain after leg swelling is an emergency. Persistent vomiting with dehydration is not something to sit on. There is a difference between being calm and being passive. Do not confuse the two. The entire reason this cancer keeps winning is that it hides behind explanations people find easier to accept. Aging, stress, dehydration, gas, heartburn, diabetes, back strain, a sensitive stomach, a bug. One more odd thing that will probably pass. But cancer loves probably. It loves delay. It loves vagueness. It loves embarrassment. It loves the month that turns into 3 months because nobody wanted to make a fuss. Do not give it that advantage. If this video gave you information you had never heard explained this clearly before, hit the like button right now. Subscribe if you are not already here, because every week I break down the health warning signs that older adults are too often expected to ignore until ignoring them becomes dangerous. And share this video with someone tonight. Send it to the person whose back has been bothering them, the person who keeps saying food just has not tasted right lately, the person who is losing weight and acting like it is a good thing, the person who says they are only tired. You may think you are just sending them a video. You may actually be interrupting the exact delay that puts so many families in a doctor's office, hearing words they should have heard months earlier. And there is one more thing I need to tell you before this ends. There is a specific combination of symptoms that should immediately push pancreatic cancer much higher on the list of possibilities in a senior, especially when it includes changes in urine, weight, and digestion all at once. There is also a reason some people with this disease get reassured after one normal test, even though the real problem is still there. Most people do not know which test can miss it, which imaging study is usually better, or which follow-up question changes the entire appointment. That is what the next video is about. Watch it before you talk yourself into waiting, because when it comes to pancreatic cancer, the most dangerous symptom of all is delay.